To complete a MCP joint assessment, we want to look at the general posture, dorsal and volar. We want to observe orientation of fingers as well as color and swelling. If you look at the skin, you can appreciate small swelling if you look at the fine lines in the skin that cross the MCPJ. Any swelling you detect will flatten out the patterns on the skin. Always palpate the injured area along the tendons, along the sides of the joint, and flexor tendons of the volar plate. Look at active range of movement. Start with extension, bending your fingers back as best you can, and full fist to see global range of movement. While the client is in the full fist position, we want to look at the centralization of the extensor tendon during that full fist to make sure the tendon is gliding and sliding and not rolling off the metacarpal head. We also want to look at the hills and valleys to detect small swelling and any change in pattern. And can you complete the... so we want to assess the lumbricals to see if they're working and if they can isolate that movement. While they're in this position, we can assess intrinsic strength. So this position already is already a grade 2 to hold the MCPs partially flex but not fully extend, and applying some resistance. That would be a grade 4 to 5 manual muscle test score with some resistance. We can assess the finger abduction and abduction. So open and close, and we compare with the unaffected hand. Open, close, perfect. Another way of assessing intrinsic strength as well is seeing how hard they can squeeze between index finger and middle finger and ring finger. Index and middle, so squeeze into the pen as hard as you can, perfect, and then like this, perfect. We can also assess intrinsic length, holding PIP and DIP in flexion, and hold position and gently extend. Assessing collateral ligaments. So we want to assess radial collateral ligament and ulnar collateral ligament. We hold the MCP in flexion, and with our other hand complete firm ulnar deviation stress and radial deviation stress. So applying firm resistance ulnarwards and firm stress towards the radial side. To assess MCP synovitis, we want the patient hand flat on the table to complete passive hyperextension of the digit. If the joint is swollen, movement will be reduced. So your middle finger, bring it up as far as you can. Perfect. So if the joint is swollen, this movement would be reduced. To assess intermetacarpal ligament, you will note by making a firm fist, and if positive, and making a firm dip, alternating the MCP side to side. Assessing someone with a stiff joint, you want to look at the accessory ligament of the joint. With the MCP joint, they roll and glide as the proximal phalanx flexes on the head of the metacarpal. It obviously rolls forwards and it also glides forwards. So to check accessory movement of the joint, we want to stabilize the metacarpal with one hand. With our other hand, using thumb and index finger, appreciating the amount of movement dorsally and volarly. We can also complete a pencil test to assess pain and injury around the MCP. So in a relative motion position, using the pencil test, putting the finger, other pencil underneath the middle finger, and then get the client to make a fist, and then straighten, and then bend their fingers down again. So an extension and then a flexion position. So then, ooh, get your hand like this, and then bring your fingers up, and then bringing your fingers down. Perfect. And to measure extension, we want the client to bend their finger back as far as they can. Very nice. Can you go further? Ooh. So that's about 28 degrees, and so there'll be negative 28 degrees. And then if you can get the client to bend their finger as far as they can to make a fist, perfect. And that would be about 80 degrees flexion. So that's how you measure finger range of movement with a goniometer.